We would like to introduce you to Margaret Filley, a lifelong motoring enthusiast who lives in Hampshire.
I am very nearly 80 and I'm very aware that personally I have eyesight problems, so I will have to make decisions about my life. But I want to help others make the right decisions for themselves, their family, and other people, but to still enjoy life.
Margaret knows that her days of being able to drive may be numbered because of an eyesight issue that's likely to get worse in the months and years to come.
I do have a degenerative eye condition, macular degeneration. I've also got cataract problems. Both my parents were registered blind for the last few years of their lives, so that I've always been aware that eyesight would be a problem. So I am tackling being carless, which could happen in another 6 months' time, with determination that my life will still be independent, interesting, and I can help make a difference to other people, which I love, even though driving won't be possible.
Let's meet the expert responsible for Margaret's ongoing eye care.
My name is Bryony Allen. I'm an optometrist and professional services manager for the Leighton's Opticians and Hearing Care Group. Mrs. Filley first came to Leighton's Opticians in our Camberley practice in 2019 and started to have her eye examinations with us at that point. And then she approached us to discuss safe driving with regards to vision.
Leighton's Opticians diagnosed macular degeneration in Margaret, and they monitor this through thorough examinations every 6 months.
So macular degeneration is an age-related condition where the central part of the retina, the back surface of the eye, deteriorates as we get older. And it can cause some blurred vision, some visual disturbances, perhaps some lumpy bumpiness within the vision, and eventually can lead to a blank area within the central vision.
Is macular degeneration a condition drivers can spot for themselves?
People tend to know if they have a sudden change in their macula, so if they have a bleed on the back of the eye, which is a wet form of macular degeneration, this will often result in a sudden loss of vision. But the earlier stages of dry macular degeneration are often not detectable by the patient themselves, and it's only through monitoring and evaluating the health and the back of the eye that we can see those changes starting to occur even before the vision has become damaged in any way.
Bryony Allen is keen to point out the differences for people between being in the optician's consulting room and being at the wheel of a car.
So when we think about vision when we're driving compared to vision in the optometrist's consulting room, we're very much focusing on central detailed vision with letters in the chart, and then our field of vision, our peripheral vision in the consulting room. In reality, things move and change quite quickly out in the real world. So the vision that we can assess in a consulting room is really a snapshot at that moment in time and measuring detailed, concentrated vision and vision around the edges. What we're not able to look at is how quickly we're able to react when we do see something. So it's a good starting point, but it can't be the be-all and end-all.
And what does Bryony say to those drivers who feel it may be better to avoid an eye test in case there's bad news?
We advise everybody to have an eye examination at least every 2 years. As we get older, that becomes more and more important because vision changes gradually and we don't notice one day we wake up and we've turned 50 or 60 or 70-year-old and suddenly think, oh goodness, my vision has changed overnight. You know, it's a little bit like we wake up on a birthday and we don't suddenly have a full head of grey hair. These things are very gradual changes. And so it's really important that there's an objective measurement at points in time, which is what an eye examination will do. Another key element is that vision and health are intrinsically linked but not mutually exclusive. So we can have a very healthy eye and poor vision, and we can have fantastic vision and an unhealthy eye. But if we have an unhealthy eye, it's likely to result in reduced vision over time. So the earlier that something is found, the more chance we have of dealing with it, whether it's a treatment, a management, or just counselling and understanding what's going on. So the key really is to have those regular examinations so that we can provide the best possible advice and care, both for the here and now and looking to the future as well.
The advice to get a regular eye test is supported by the police. Here's PC Liz Johnson, Road Safety Officer for Thames Valley and Hampshire Police.
Okay, as a mature driver, we would recommend that you have your eyes tested regularly. It's something that you may not realise that is deteriorating, so please do go and get your eyesight tested. Do check out these websites for older driver assessments. It might be that you're lacking in confidence, especially if you've not been driving for a while. So have an assessment, and then they will be able to give you tips that you may be lacking on and give you the confidence to be able to drive those journeys that you want to. We want to keep you safely on the road for longer.
Let's conclude this first meeting with Margaret Filley and find out what happened at her most recent eye examination.
I had my last 6-month appointment a week ago, and I have been told I am clear for the next 6 months. So I was very pleased that I'm going to be able to enjoy driving throughout 2021, but I know that I have to prepare myself for being carless.
We'll meet Margaret again in early 2022 to find out how her condition has developed and whether she is still safe to drive.